for 5 minutes of questioning.
Mr. Secretary, welcome. Thank you for your time and your service. I am grateful for you being here. We've gotten to have some real good conversations here today because when it comes to the health of this country, as has been said many times before, we do not have a health care system. We have a sick care system. I'm just going to jump directly to my questions here. In your time and your research, do you have any objectives or any ideas on how to reverse the perverse incentives and some of the abuses that are happening with big companies and big government that are hurting people right now?
I mean, at every level of the system, there are, as you say, it's just a bundle of perverse incentives that encourage people that basically put every actor in the system, pharmaceutical companies, providers, hospitals, insurance companies, in a advantageous position if they increase the number of sick Americans and the level of our illness. And the way that we need to change that broadly is to realign the incentives so that people are getting paid to actually make people better. So we want outcome-based medical care. We want value-based medical care. We're working through the Center for Medical Intervention for CMI at CNN to explore a number of pilot projects that will do just that. And then we want to roll them out across the system. But we're looking for every opportunity, and I had meetings all this week, including with all the big insurance companies that will do exactly that. They want to do it too. They understand this is not what anybody wants. It's
And
not
we've
good
spoken
for
with insurance companies too, and that's a big issue. But another big issue in the United States is we are still treating all calories equal, and they should not be. Ultra-processed junk food doesn't stack up to the calorie from an apple or fresh Michigan produce. We all know that we need to step up and address the fact that ultra-processed foods drive obesity, heart disease, and diabetes. But in Congress, we're still tiptoeing around the fact that less than 10% of Americans even follow current guidelines. Current food system is poisoning poor people, and it's wrong. During this drives up costs in our healthcare system or sick care system, and it drives up our national debt. It's a national security issue. Are there any plans that you can share here today to address the food deserts in urban areas and rural areas across states like Michigan? You mentioned changing some incentives. Well, the leading areas before people get sick in the first place is a great place to do it.
Yes, Congressman, the first thing that we need to do is to recalibrate the dietary guidelines, and those are due in December. We got a 453-page document from the Biden administration that was just the product of the same kind of industry control that put Fruit Loops at the top of the food pyramid. And we're now going to give Americans a 4 or 5-page document that tells them what they should be looking for, particularly in their locality. And when we do that, it's going to drive good food. It's going to reduce the amount of processed food in our school lunch programs, in our military, in our hospitals, and other institutions. And it's going to drive good food. That's going to create markets for good food all over the country. And that's one of the ways we penetrate the food deserts.
Very good.
There's also programs under Medicaid to make sure that people in food deserts, on Indian reservations, in urban areas, et cetera, can get good food.
Very good. We absolutely have to take care of the poorest of the poor. We need to make sure that folks who deserve it can have support from us. Yesterday,
by the way, we're going to have the dietary guidelines out at least by August, so we're going to be months early, and I'm working with Brooke Rollins on that. And they're going to be very good.
The government being early on something, that's great. Secretary Kennedy, yesterday you and CMS Administrator Oz secured an industry pledge to fix our broken prior authorization system. I hear stories from places like Flint, Michigan, where Dr. Bobby Mukamala sought prior authorization for full cancer screening after his patient's stage 1 tonsil cancer diagnosis so that he could determine the best treatment outcomes. When the patient finally received the PET scan 3 weeks later, the cancer had progressed to stage 2. These prior authorization reforms are critically necessary. What are you talking to industry folks about to hold them accountable for their pledges?
The largest companies in the industry, and I brought them all together, have now made the pledge to us yesterday that they're going to get rid of 80% of the prior authorizations. And they're also going to, make their their systems interoperable. So it's much easier for a doctor to very quickly, before you leave the office, you should have that prior authorization.
The gentleman's time has expired.